Anderson, Public Policy and Regulatory Affairs Director here at Blue Cross Blue Shield of Michigan. I'm also a member of our Blue Cross Blue Shield task force dedicated to addressing the opioid crisis. I'm fortunate today to have with me Dr. William Beecroft, one of our experts here, and we're going to talk today about the crisis, how we're addressing it, and specifically talk a little bit about how you can help a loved one who may be suffering from addiction. Dr. Beecroft, thanks for being with us today.
Thanks for having me.
I'd like to start off right from the beginning. What is an opioid?
Well, opioids are natural compounds that we actually have within our bodies. They're a natural protection from pain. So if you have an injury, you'll initially feel the pain, but after a short period of time, there's a decrease in that pain. So you can be able to get out of additional painful circumstances or get out of harm's way. What these chemicals do is they bind to receptors in the brain, and in that it has a cascade phenomenon that alleviates the pain sensation. Opioids in general are opium and morphine are natural compounds that are found in plants, poppies, and these mimic the same chemical properties that are intrinsic or internal opioids are, which are called endorphins or enkephalins. These have also been synthesized by man, and you have other ones that are much more strong, such as heroin is a chemical that's not used in the United States for a medicinal purpose, but it is elsewhere in the world. OxyContin is another name for it. Vicodin is another name for these medications. So they've been turned into medications in addition to an abusable substance, but they do mimic a natural property that we have within our bodies.
So what I hear you saying is they can be a really effective treatment for pain, but they're also dangerous. Can you explain why they're dangerous?
Right. They are an effective tool for management of pain. They alter the perception of pain. They don't stop pain per se, but in that alteration of your perception, that can be a beneficial effect when you're in the circumstance. It can also be a negative effect because as it's altering your perceptions, it also is your perception of events going on around you, the normal processes of daily life become skewed. Become more sedated, more drowsy with these medications or with these chemicals. So that's where you can get into real trouble with them, because very rapidly you can become addicted to these medications. You need them because they are more powerful than your internal opioids are.
And that's why they're so difficult to quit.
Exactly. They suppress the internal chemicals that you're producing, those endorphins and enkephalins. So when you try to stop using the opioid that you're ingesting from whatever mechanism, either orally or injecting, you have no backup. Basically, it suppresses them such that when you stop using the other substance, your body doesn't have a reserve to come back to normal. And that is where the addictive process can also be very circular in that regard. Also, we do grow more what are called mu receptors, which is where the opioid binds in our nervous system. And these receptors become very sensitive when you decrease the amount of drug you're taking, either from a medicinal purpose or from an abusive purpose. That then causes more discomfort, more pain, if you want to call it, and cravings for the medication or the drug that you've been using.
So if I understand the statistics correctly, opioid deaths from overdose have tripled in Michigan over the last 5 years. We've reached a point where there was this medicine that was intended to help for pain, and now we're reaching a crisis point. What are some of the reasons that you believe we've reached this point?
Well, that's correct. The opioid deaths have really surpassed in last year were about 66,000, which surpassed the number of people that died in Vietnam. In the entire war. So more than traffic deaths at this point. So it's really been a significant crisis. It has expanded because of the access to medications, extra medications that have been prescribed by physicians for legitimate purposes, but don't get used up. And those are available in the community, available in many medicine cabinets and that sort of thing. A statistic is that 70% of young people that are using opioids got it from a family member in a drug cabinet somewhere. So that's a big problem. The easy access to synthetic narcotics, such as fentanyl and its variety of cousins that can be purchased on the internet. These are things that have really gotten into our society very, very quickly, and they're extremely powerful. They're 70 times more potent. Fentanyl itself is 70 times more potent than morphine is. And some of the, as I call them cousins to fentanyl, are well into the hundreds of times more powerful than morphine is in and of itself. And this is lethal. You can only get to a certain amount of this and you stop breathing. We can't live very long when we're not breathing.
I have heard that. I'm not a medical professional, but I did understand that. Moving on to what some of our viewers may be experiencing, what are some signs that a person is suffering from addiction?
Well, some of the signs are that they really have a change in their personality, their persona. They tend to become more secretive, they tend to spend more time by themselves, they tend to be less spontaneous. Some people just aren't as happy. They're more flat as far as their affect or their engagement with others. So there's a lot that really changes for a person. That then affects their employment, their jobs, their ability to be productive. Interest in hobbies kind of goes away. So things that used to be fun for them, just they don't care about anymore. Again, it's changing your perception of what's going on around you. And the perception is you want to be in this comfortable space that people don't intrude. And that then starts taking away from the other things that are enjoyable for us in our lives, our families, our involvement with other activities that we'd like to do.
So what are some ways that we can help someone that is suffering from addiction?
Well, we all have significant others of a variety of different natures, either families, traditional families or untraditional families, friends, people that we work with, coworkers, these sorts of things. And they may notice some of these changes and be able to reflect them back to the individual. They also can be helpful in the sense of providing feedback. Hey, you're really not looking like you used to. Is there something going on? Trying to be helpful and to try to engage that individual into recognizing that things have changed for them and that people are noticing that at this point. Employers may look at performance evaluations and be able to say, hey, you're just really not doing quite as well as you used to. You just don't have the same spark that you used to. Is there something happening for you? And raising those questions starts to get the individual thinking, well, maybe I'm getting found out that I'm using these opiates, because they know what they're doing. It's just they don't realize how far they've gotten into it. It doesn't take very long to get addicted to these medications. And when I use the term medications, rather than a more pejorative word of drugs, it's the medicinal purpose is the intent for a lot of people. And with these, it only takes between 3 and 5 days to start getting into a dependence. And within 2 or 3 weeks, you can become very addicted to these medications. So they are very rapidly addictive, and this change happens in our brain to become dependent on them.
So if someone identifies that they have a problem and they're going through recovery, how can you continue to support them through that recovery?
Well, the biggest thing is that by the time they get into recovery, they've already recognized that they have a problem, and they've been educated through the treatment process as to the consequences of the use of these drugs or medications. on an ongoing basis. Once your body has acclimated to these drugs, they very rapidly will readjust to their use again. So it becomes a chronic illness that once you've stopped using opioids, you really need to never start them again. It becomes all of the work that you've done to get away from the use really comes back very, very rapidly. So for the other people helping, once you've gone through that recovery process, become drug-free for an interval, at least 2 or 3 months, then families can be, support people can be very helpful in getting you active again, doing the things that you used to like to do, really engaging you back into the life that you had and can have again in the future. Being able to use goals that you can set for yourself, going to a child's wedding or graduation, that really is important for you and that you'll work towards that end, or that you're going to be able to go on, say, a vacation, or you're going to be able to do some type of social activity in your community that you've looked forward to. Those are the things that then can keep you moving towards a positive outcome. And once you achieve those, then that's exciting too. And again, some of those natural chemicals that we have that cause us to be happy and excited can get released and reinforce that more positive behavior.
Thanks. For our viewers, we do want to say, if you do have questions, you can leave them in the comments, then we can ask Dr. Beecroft here. So we'd love to get any thoughts, questions that you have so that we can answer those for you. Going along with that, if you have a friend or family member that you may be suffering for addiction, where's some place you can go to find help?
Well, there's several places that you can go. There's a variety of different treatment centers around Michigan that you can be able to contact either by phone and make an appointment to go and be evaluated, or many of them have access centers that you can just drop in 24 hours a day, 7 days a week to be able to get screening and assessment there. You could also go to your primary care doctor. They're very adept at being able to understand the problems with this and get you referred to someone that has more expertise in this area if they don't have the expertise themselves. So though that access to treatment is really relatively easy with Blue Care Network and Blue Cross Blue Shield. On the back of the insurance card, you have the access number for the behavioral health departments that can steer you in a direction of getting to one of these centers and get you information as to your resources that are available to you in your community. I say community because it's really important to really stay and fight this disorder in your community. Fight it at home. Some of the difficulty we've seen is people go to destination treatment centers, and when they come back, they end up being back in the same circumstance because the families, the support people in one's life have not been involved in that treatment process. And unfortunately, what happens with that, there's just a breakdown in that communication, and that stress coming back into the environment in which they are now living again becomes very detrimental. We believe strongly, and what I see in the treatment of individuals is that really engaging with as many support people that they have in their lives, being able to heal the wounds that have occurred over a period of time, fighting this illness and fighting this disorder, to be able to re-engender the new life that they're going to be in a drug-free world. That's really done in our home environment. And we've got the tools here. You've got your primary care doctor, you've got the treating providers, as I say, you've got your family, you've got your spiritual resources. All of those things are really important here. And I would really emphasize that that's a big, important step to do.
Thank you. I think that's very helpful. Looks like we do have a question. Mary would like to know, can marijuana and alcohol abuse lead to opioid abuse?
Always a controversy as to gateway drugs and that sort of thing. Can they? Yes, if you develop a lifestyle that is chemically dependent, that can be, a step into use of opioids also. One of the biggest areas of opioid use disorder is the mixed drug user that has opioids, cocaine, marijuana, a little amphetamine, a little of this, a little of that. And those people have a significant difficulty being able to get off of all of those different chemicals. And to get there, they have to have used some of them along the way. And that's the biggest majority of people with opioid use disorder. The individual that has a pure opioid use disorder is relatively rare, maybe 5 to 8% of all of the people that are using opioids in a use disordered way. People with chronic pain can develop use disorders also, and I emphasize the fact can develop that because of the exposure to these chemicals, but it doesn't mean they will. They can be used effectively for chronic pain management as part of a overall comprehensive treatment plan.
It looks like we've had a question too from Nicole, who asked, what can I do in my community to make a difference?
There's a lot of community activities that are going on. My Blue Perspective is a site that we have that can be able to kind of direct you to different activities that are going on, drug take-back programs, social activities, celebration of sobriety and celebration of being drug-free. Those activities occur around the state, and you can get those listings through that site and others. Just even Googling some of these other resources may be helpful for you to be able to find something you can do in your community. And then the spiritual community, the faith community is really very important too in this area and has activities that can go on.
Okay, thank you. I would even add to that, there are a number of good organizations, one of which is Families Against Narcotics. A number of chapters are spreading out through Michigan. We've been working closely with them, but they're to provide support for families, for those suffering from addiction, their families, and really trying to go across the state to provide resources people need. Dr. Beecroft has mentioned before, drug take-back days, the amount of supply that's out there, and some folks will use drugs that are left in medicine cabinets, so just getting rid of those drugs can be helpful. And broader than that as well as just awareness. I think as human beings we often think about this can't happen to us, but this problem gets wider and wider, and it's happening in every community across Michigan. So making people aware that it's all of our problem, that the amount of drugs, and we can all make a difference by making people more aware of what the consequences can be of keeping those drugs in the medicine cabinet. So those are a couple other ideas about things you can do in your community. We do have another question. What is being done to monitor doctors who may be over-prescribing?
This is an area that has become more attention has become focused on physicians that are doing this, that are really working outside the parameters of what would be normal practice. Michigan Licensure Board, LARA, is looking into this. Pharmacy Board keeps track of this. The DEA, Drug Enforcement Administration, keeps tracks and profiles. And Blue Cross Blue Shield and BCN, through our Controlled Substances Work Group Committee, also look at keeping track of these outliers of physicians that are prescribing way more narcotics than what would be seen in a normal practice. The issue of pill mills, there are doctors that just do this and will have pre-written prescriptions for patients to come in and purchase. These are being cracked down upon with local law enforcement. And as I say, the Drug Enforcement Administration is very adept at being able to ferret these providers out and be able to get them out of our provider community.
All right, thank you. Is there anything else that you would like to get help our viewers understand, or that are important things about this crisis that would be helpful for them?
This is a treatable problem. This is an issue that people can get back to a much more normal drug-free life. It's not easy to do that, and there are tools that we have as providers, not only the recovery community, which is really important, 12-step programming, but also using for the support people of a person that's afflicted with this, using things like even Al-Anon can be very helpful for you to understand what is important to not facilitate the illness and to be able to help the individual stay in recovery. Al-Anon has been classically thought of as for alcohol use disorder, but it can have the same benefit because the same general principles are for use of marijuana, for use of cocaine, for use of opioids. So the same general principles can be helpful, and it's something that actually you could do together. The afflicted individual could go to the Narconon meeting that they need to go to, or Narcotics Anonymous, and then the other person, the support person, could go to Al-Anon and be able to learn more of the same techniques. So it could be something that you could actually facilitate that significant other feeling like they're not alone, that they're actually being working with a buddy or a partner in this process to be able to fix this. There are medications that can be very effective. Suboxone, naltrexone, and methadone even can be very helpful to be able to alleviate the cravings, the difficulty, the discomfort of the withdrawal process, but also the maintenance process. And the statistics are that persons with, I'll use Suboxone as one of them, people that stay on Suboxone for a period of 6 months, their 5-year survival rate, and survival rate I'm using in the context of staying drug-free for a 5-year period of time, substantially improves at the 6-month window. When you get to a 2-year window, the survival rate approximates a normal person that has never been opioid addicted. So these are very helpful medications. It's a tool to be able to help people beat this disease. And if you think about it, it's kind of like a diabetic with insulin. You can't just do this without the medications necessarily to be able to keep you well. And once you are well, the even insulin dose may be able to go down some, or other medications may be able to help keep your blood sugar under control. So it is like any other chronic illness, that these are tools to be helpful in this whole process of healing.
Thank you very much, Dr. Beecroft. We definitely appreciate your time, expertise, and furthermore, your efforts to help those here at Blue Cross, helping those of our members that are suffering from addiction. We really appreciate it. For our viewers, if you do want more information, again, please visit mybluesperspective.com for more information about the crisis, what you can do to help, what you can do to help a family member, what you can do to help in your community. Dr. Beecroft, it's been a pleasure. To all of you, thank you for joining us.
Thanks for having me.